Hi, I'm Ashley, and today I'm going to be giving you a little bit of information about ACL injury prevention in hopes that maybe some new starting out coaches or some athletes who don't know too much about it could get some information, some insight on how to reduce the risk of injury. First, let's discuss what an ACL is. The ACL is one of many ligaments in the knee. You have your MCL, which is medial, closer to the inside of your knee, the LCL, lateral, which is the outside of the knee, your PCL, which is the thicker of the two that go through the inside of the joint, and then you have your ACL, which is the thinnest ligament in the middle of the knee joint. Now, when this is torn or sprained, it becomes very hard to walk. So when you sprain it, you can sprain it or tear it when running, jumping, or cutting. Cutting is just quick change of direction. A lot of times you'll see it in football, soccer. I mean, pretty much any sport, you'll see cutting. Now, some signs that you have torn or severely hurt your ACL is you'll start to hear a pop, you'll get instant swelling, there will be severe pain, and it's going to hurt insanely to bear weight on that knee. Now we're going to talk about some fun facts that in my research I found that I find very helpful. I didn't know a lot of this information before I started researching, and I just feel like it's super helpful to talk about statistics and this type of information before we get into exactly how to prevent and like different programs to use and stuff. First being that those with ACL injuries are more likely to develop arthritis in that knee because after surgery occurs, because the knee is reconstructed, it tends to be more prone to wear and tear. There's a lot of grinding and just constant bending that happens in the knee, obviously. So the protective cartilage obviously gets worn down more so than it would if the ligament was fresh. Secondly, this is so important if you're a female athlete to listen to this and to understand why it's so important for us to do preventative exercises. Females are 9 times more likely to sustain an ACL injury. It's because a lot of times our form isn't correct because a lot of things are taught to be done through the male form. But our pelvic girdles are naturally bigger, wider set than man's. If you look at the picture, you can see like how differently they're shaped. And so when we stand shoulder length apart, it's not straight with our hips, if that makes sense. So when we bend, knees tend to cave in, and instead of going straight down, we tend to cave in, which causes a lot of strain on unnecessary ligaments. Lastly, it's important to note that ACL tears most often occur in non-contact situations. So in situations where you're cutting or trying to make a quick play, that's where you'll see ACL tears most. So now that you know a little bit more about what the ACL is, the anatomy of a knee, some fun facts, and reasons why it's so important to keep your ACL healthy, we're going to talk a little bit about prevention. Now, a prevention program is something that athletes incorporate into their daily training along with like their weights, agility training, practice. You could do this before or after any practice. It's just to build on top of it so that you know you're getting the right technique in, and just like it says, it's preventative. So according to Mayo Clinic, prevention exercises like strengthening the muscle, hamstring, quad, doing squats will help so long as you have the right technique. A lot of isometric holds are perfect. You can do plyometric holds even. A lot of body weight banded exercises work perfectly for ACL prevention because it's lighter weight, it's not going to exhaust the muscle, and it's going to strengthen it. You'll see a lot of training for like jumping, doing proper technique for jumping, landing, cutting, pivoting, all of those types of things, because that's where you see the most tears on the field is in cutting and pivoting, quick change of direction type of things. However, you can tear in the weight room, which is why they also have preventative exercises for technique, which is working on proper technique in squatting, lunging, deadlifts even. Those are ideal. However, I would like to point out that there has been no specific evidence that any type of prevention is superior. So any of these would be great to incorporate into your everyday movements, everyday training, so that you can hopefully prevent an ACL tear. If all else fails and prevention does not work and you end up tearing your ACL, you are gonna have to get surgery. In most cases, at least, if it's a complete tear, they're gonna take a skin graft to mimic the soft tissue of the ACL and try and completely remodel that ligament. After your surgery, you're gonna have to get physical therapy, which could take from 6 months to a year, depending on how quickly you wanna get back on the field or back to everyday life. They usually start out with just body weight, like trying to lift up your leg when in a sitting position. Later on, they'll try and just put body weight back on that leg, try and get you used to walking again. And then later on, towards the end of your recovery, you will start to run and jump. To talk to an athletic trainer who used to work here at Nova, and these are a few of my favorite quotes from the interview. She said that there is no wrong time to start prevention, and anything is better than nothing. So whether you want to do 1 or 2 exercises before practice or 1 or 2 exercises a week, doing something is better than not doing anything at all and just doing the wrong movement and the wrong technique. Secondly, she said that she doesn't think people understand the mental toll that athletes go through when they're going through recovery, whether it's like watching their team go on without them and like having to sit on the sidelines where they would normally be on the field or the court. And lastly, the biggest thing she would want to put into a prevention program for her athletes would be band work. So like the tiny little bands going in, just doing some light resistance, not really working on heavy weight, not overbearing the leg. And to close out this video, I'm going to give you my conclusion. Essentially, an ACL tear is completely preventable, and it's often overlooked, though it's the most common injury among collegiate athletes. And the road to recovery is so long, and it's possible that a player won't be mentally or even physically the same when they return. So do your prevention and have a great day.